Hi, I'm going to talk about how a birth support professional can help a first-time mother. So for your first baby, you may be a bit more anxious or uncertain about pregnancy and birth compared to a mother who's previously given birth. You may not have had as much experience around babies, or your friends might have not had pregnancies yet. And you might have only experienced birth from what you see on the TV, which unfortunately is dramatized and doesn't actually show what happens in a normal, healthy labor and birth for best outcomes. For example, the rooms might be loud, noisy, and with bright lights, and the woman's laying on her back, laboring and giving birth. Well, unfortunately, these things can slow down your labor. So if you've got, for example, a doula or a birth support professional in there, they might encourage you to dim the lights and have some peace and privacy, and also to help you to change your positions so that it's favoring a good, healthy labor. Because the obstetricians and midwives, for example, don't always have time to do all the things that they should be to help keep a labour and birth normal, because they're so busy with their own scope of practice, because lots of things do happen in some labours and births. Some things can happen quickly and they're so busy that they don't have time to focus on the little things that can help you along the way. And because they don't do it, a lot of women assume that what they're doing is what they need to, everything that they need to. However, they don't always have time to cover your comfort measures, to massage you, to help you change positions, or give you as much emotional support that you might need, especially with your first time mum. And they've also just met you, so having a doula that you know, a known woman during your labour, is really important, because it does show that birth outcomes are improved. So building up a relationship with someone who can assist you during the pregnancy, so whether it's as a doula or a birth educator who's also going to attend your birth, it's a very important relationship, because it does actually increase the better birth outcomes. It's recommended that a first-time mum does have 16 hours of birth education. So choosing a birth professional who is a birth educator can be helpful. Birth education is a little bit different when it's an autonomous birth professional, because they're actually teaching you how to be empowered, how to have a normal, healthy birth. Whereas if you are going to, say, a hospital facility, for example, they often are teaching you how to fit in with their system, not necessarily teaching you all the things that can favour a normal, healthy birth. It's also useful to have a woman that can support you with acupressure, warm packs, TENS machines, food and drinks. Some women also like to have aromatherapy or homeopathic birthing kits, so assistance might be needed with that. And a birth support pro can also assist you in labouring in the home. So if you're labouring in the home, you might still need some help and support and encouragement, especially if you are a first-time mum. And then they can also follow you to a facility. So if you're going to a hospital, for example, they can follow you there. In general, a doula can result in a lot higher birth satisfaction because you've got someone to help you along the way, empower you, encourage you to stick to your birth plan, and also help you understand what's going on, especially if there's some sort of intervention that's recommended and you don't know about it, like you don't understand it. A doula can help you to understand what is going on, what's happening, why you recommended it, and also ensure that you're feeling comfortable about it and helping you to ask the birth professional, as in the midwife or the obstetrician, questions so that you do understand what's going on and that you can make a proper informed choice. Sometimes, again, when you're in labour, you're in your own world, so you might not be as inclined to be able to articulate questions, so just go along with what they say rather than actually do what you want. In general, a doula is less likely to lead down the the road of interventions because you've got the person to help you through it all. There's less risk of surgical as well as instrumental births, so your cesareans and your ventouse and the forceps. And you're also less likely to ask for pain relief if you've got a doula there. So again, because they're assisting with change of positions, they might give you a little bit of massage and assist you with all the comfort measures as well as the support. Every time you do have an intervention, it can set you up for further cascade of interventions because sometimes you need multiple interventions for one. For example, with an epidural, you also need a catheter because you can't feel your bladder, and there's a few little things that go along with that. So the more that you do to interrupt normal healthy labour, the more likely you risk in more and more interventions. So often women who've had an epidural could be risking a higher risk of cesarean. So if you had the doula in the first place to stop you from needing to ask for as much pain relief, then you're probably going to be better off. As soon as birth does occur, a doula will also assist you in those early couple of hours to bond to the baby, to settle the baby. Breastfeeding, they'll usually set you up with immediate skin to skin contact wherever possible because that favours everything, the health of the baby, the health of the mother. It favours the breastfeeding and the bonding and all that. So there's a lot of support there for you if you're a first time mum from a doula, and I hope that you would consider me as a doula. And I service the Mornington Peninsula, Southern Bayside, Casey Dandenong sort of areas, and I love assisting women for both birthing in the home as well as the hospital, both first time mums as well as subsequent mums who've previously given birth. And thank you for listening, and I hope you have good luck with your journey in pregnancy, labour, birth and the postpartum experience. Bye.